which calls for discussion-based frameworks to support clinicians in anti-racist communication and trust building. The Presence 5 for Racial Justice is an emerging framework intended to support Black patients in getting great care. Presence 5 for Racial Justice incorporates human-centered design and community-based participatory research with input from patients, clinicians, previous literature, and non-medical professionals. In this module, we will be focusing specifically on anti-Black racism to provide strategies that target the unique experiences of racism affecting Black patients. However, our hope is that these strategies are generalizable to a diverse group of patients. The Emergent Presence 5 for Racial Justice, P5RJ, practices include 1. Prepare with intention by reflecting on identity, bias, and power dynamics. 2. Listen intently and completely without interruption, and listen deeply for the potential impact of anti-Black racism on patient health. 3. Agree on what matters most by having explicit conversations about patient goals, treatment comfort and consent, and referral planning. 4. Connect with the patient's story, acknowledging socioeconomic factors influencing patient health and focusing on positive efforts. And 5. Explore emotional cues by noticing and naming patient emotions, and considering how experiences with racism might influence emotions. In alignment with community-based research, this CME was developed by a community advisory board of Black patients and clinicians who treat Black patients. The following scenario was developed by those patients and clinicians, drawing on their lived experiences. In this video, let's consider the practice of exploring emotional cues. As a reminder, Presence 5 for Racial Justice practice on Explore Emotional Cues includes noticing and naming patient emotions, and considering how experiences with racism might influence emotions.
Hi, how are you feeling today?
All right.
Consider how you might explore the emotional cues that the patient is displaying.
Today, I just want to make sure your injuries are healing properly and that you're improving overall. Let's start with your tibial fracture. Have you had any soreness around your leg?
It's all right. I think I'm doing fine and don't need any more help.
I'm glad that you are doing fine, but I'm observing from your expression that you might be frustrated. Is there something else going on that I can help with?
When I was brought here, the doctor called the police because he thought I was in a gang, even though I was a bystander that had just been shot. The police even told me I was lucky that there wasn't more evidence. I'm just trying to get out of here as soon as possible.
Consider behaviors and language you could use to help the patient feel comfortable talking about their experiences if they want to.
I am so sorry you had that experience here. That was unacceptable for the doctor to make an assumption like that. I realize I can't take back your experience with the other physician, but I want to do whatever I can to make sure you feel comfortable sharing experiences and information with me that may impact your health, so that I can do my best to help you.
Thank you for saying that. I'm just really uncomfortable being back in a hospital and with a doctor. I want to get better though, so I'm here.
I'm glad that you feel a little better talking to me. Let's go back to discussing your fracture and let me know if you need a break from talking about anything.
Think about what you noticed in this interaction. Let's take a look at the evidence related to exploring emotional cues. Clinicians block discussion of emotional issues more with Black patients and provide Black patients fewer passive responses that permit emotional talk. When clinicians attempt to elicit and identify patient emotional cues, that is associated with greater patient satisfaction, appointment adherence, and learning of conveyed information, even when the clinician is mistaken about the emotion being expressed. To further learn from your patient's emotions and support them, consider these practices. How can you learn from your patient's emotions and support them through experiences with racism? Here are some examples. Ask to confirm what emotion you see or hear and follow up with what you can do to address any concerns. Recognize emotions tied to racial trauma and explicitly name racism. Consider how current events may affect your patient's mental health and feelings of safety. Improving care for Black patients requires clinician self-reflection, personal commitment, and institutional support. Incorporating these Presence 5 for racial justice, evidence-based strategies into your clinical practice is one way in which you can make a positive difference in the lives of your Black patients.